everyone. Welcome to the show. My name is Bas Gerges, the co-founder of Akina Pharmacy, where everything we do centers on one core philosophy, which is also reflected in our name. And that's to do the right thing at the right time, in the right way, for the right person, for the right reasons, the first time around. And on this podcast, we sit down with people in and around healthcare who are pushing boundaries, solving real problems, or simply rethinking how meaningful work gets done. And today, I'm joined by Jill Sohayda, a former primary care physician who now focuses on integrated wellness as the owner of Essex Medspa in Denver, Colorado. And Jill has a deep passion and expertise in hormone replacement therapy, cholesterol management, and overall integrative approaches to medicine. Recently, Jill and I connected around the importance of debunking myths and optimizing patient outcomes when it comes to HRT therapy. That's hormone replacement therapy. And I thought this was a conversation that was very much worth sharing. And Jill, thanks for being here. It's great to have you on today.
Oh, thank you, Bess. I appreciate it.
Yeah, absolutely. So, Jill, can you just give us a little background, on yourself and what you do today? What is your core focus and mission today?
My core focus is combining wellness with beauty because I think they really kind of go hand in hand. And so my background's in primary care, which I did for several years, but I really feel like there's more that we can do besides just handing out prescription medications. Now, I think there's a place still for that sort of thing, but I really want to educate my clients and get them the best results.
Let's kind of rewind a little bit before Essex Med Spa and before you became immersed in the integrative medicine and functional medicine world. And can you tell us a little bit about what your career looked like as a primary care physician?
Yeah. So I'd have to say, I dealt with the common things. So a lot of hypertension, high cholesterol, heart disease. I did a lot of preventative health for women and a little bit of hormone replacement therapy. Now I have to say, when I was doing primary care solely, there weren't nearly as many options for hormone replacement as there are now, and obviously not as great tests. I think there's a lot of things that have advanced in that arena. I also would say for lipid management or high cholesterol, things have changed quite a bit too. Granted, statins were back, and available when I was doing primary care, but there's quite a few other options out there now.
So you mentioned two things that sort of stood out to me there, which is the advancements in HRT. For the people out there that don't understand the acronym, it's hormone replacement therapy. You might hear it referred to as BHRT, which is bioidentical hormone replacement therapy. And for the sake of this call, we'll just refer to it as HRT or BHRT. But I do want to eventually circle back to that, which is what has evolved in access to HRT therapy from when you first started to now, and then also what evolution you've seen in the approach to specifically cholesterol management. But before we jump into those two specific topics, can you tell us a little bit about how and why you transitioned from primary care into functional and integrative medicine? What is the difference between the two? Are they technically different in their definition, primary care versus functional medicine or integrative medicine?
Yeah. Well, primary care in general, all our training when we come out of medical school, it's more of this, if you want to say, Western medicine philosophy. And there's nothing wrong with that. But there's so much more that's out there that we can combine with those therapies and give people probably better results with less side effects. So that's, part of what I was interested in. My goal when I first started out in primary care was to educate people, really work on that primary prevention. And again, if we need medications, that's great, but you have to give them all the tools. You can't just give them a medication and expect that that's going to do the trick. So that's really where I'm at now is I want to have all those different tools available to me. Unfortunately, with insurance, we're sometimes limited in terms of the options we can give our patients or our clients. And so what I'm doing now is really using my Western medicine background, but having all these other tools that I can talk to people about and really give them all the things that they need to truly get the best results.
It sounds like primary care, as it's intended to be, is really what functional and integrative medicine is. It sounds like the difference is you have the time to look at the patient as a whole. And so when you get back that time, if you're not bound by, uh, let's say, you know, reimbursements from insurance companies, right?
Mhm.
Impact your business model, can impact, how many patients you should be seeing per hour, so on and so forth. But when you say you have like more tools available to you, can you tell us what some of those tools are that allow you to take this approach?
Yeah, I mean, the difference being, okay, with primary care, if I'm doing something insurance based, there's certain medications that they will allow us to prescribe. Even with some of those medications, we still have to go through the approval phase, if you want to say. But there's some things that they won't allow us to charge for. In other words, some of the educational things, talking about supplements, maybe referring them out for other what would they consider non-traditional therapies, whether it be acupuncture or some of the tests that we do. Like sometimes they won't cover NMR, which is a special profile that we can do to get more information on the lipid density for cholesterol. So there's all these little guidelines that insurance makes you kind of go through. And again, it does limit your time with clients or patients because in order to obviously make ends meet, you got to cover your overhead. And so a lot of times if insurance is saying they're only going to cover a small portion of what you're doing, you have to limit your time and you also got to limit what you're going through with clients in terms of their options. So, like I said, there's just so many, whether it could be testing, it could be treatment options. There's all those sort of things that again, and every insurance company is a little different. Some will cover some things. And I have to say, I will give them credit. There are things that they used to not cover. They're getting better about covering, but they're still very limited in terms of the tools. Like I said, I can do a lot more with helping people with weight loss and hormones and compounded medications. Like I use a lot of compounded thyroid medications. Most insurance companies won't cover that.
Yeah.
Um, Again, compounded hormone therapy, which a lot of insurance companies will not cover. And the other part's the testing. There's just some tests that they're like, yeah, we're just not going to do it.
Yeah. And as you probably know, that's a big reason why compounding pharmacies, pretty much across the board, are out of pocket.
Right.
Most compounding pharmacies, not, I don't want to say will not accept insurance. It's they really cannot because 99% of the claims that would be adjudicated for a compounded medicine would either be rejected or would be subject to a very lengthy prior authorization process. And even the patient doesn't want to go through that. By the time they would get their medication, you're talking a month later,
Right.
45 days later. So, compounding pharmacies have transitioned out of third party payer contracts pretty much since 2014, 2015. And so the only way to provide these medications is to patients that will pay out of pocket for the most part. Now, we do send a lot of patients universal claim forms. They can always try to seek reimbursement that way, manually, let's say, through universal claim form. But again, for the most part, it's patients that are willing to pay out of pocket. And it sounds like there's a similar version of that in the medical world, which is that doctors that want to be able to offer this service, meaning a comprehensive service to the patient and a thorough assessment, you would have to have patients that are willing to pay out of pocket. Is that true? Now, is that what it looks like at your clinic currently?
Yeah. Yeah. I mean, that's pretty much what we kind of go through with our clients. And there are certain situations where they might have an FSA and HSA that has some other additional reimbursements that they can kind of get, use at their discretion. They can use their money towards that. But we don't bill any insurance companies directly.
Yeah,
I know there are some clinics out there now that are trying to do a little bit of both, but again, we don't. The other problem with doing that, again, if the likelihood that you're going to get rejected in terms of the claim anyhow, it makes it really expensive on our end to actually pay staff to be here on an hourly basis to try to go through that, because if it gets rejected, then they have to go back through, and there's all these little stipulations we have to go through. So it really, for us, it just doesn't make sense. Yeah.
So you mentioned that you now see some services that are getting covered that weren't getting covered previously. Some services that a primary care physician can offer, but usually doesn't because they're not reimbursed for their time when providing that service. So it moved in the right direction. Do you ever see it catching up, meaning all of the services that were basically the new primary care physician model, 100% of them look like the functional medicine and integrative medicine clinics, where this is the new primary care model and everything we do here is covered. Do you ever see that happen? Or do you think that's sort of a tale or wishful thinking?
I don't think it's ever possible. And here's how I look at it. The traditional medicine system is kind of a slow-moving bus. There's so much that
That
has to
makes
happen,
sense.
and you're dealing with I tell people it's kind of like in the private world, a big corporation. Big corporations typically are going to move slower than a smaller business. I just don't think it would be possible. I think there's too many hoops you have to jump through to make that change that quickly. I'd like to say otherwise. I just don't see that happen.
What has been the most significant change moving from primary care into functional medicine and integrative medicine? That transition, I think, I f- I would imagine that there's a lot of providers out there and healthcare practitioners in the position where they're like, I want to make that move. On the cusp of making that move, or they started introducing services in their primary care practice, but haven't made a full shift. For what do you think might hold people back from making that full shift? And what would you tell those healthcare providers?
I think, a lot of it is, again, if you already have income and you've kind of been stable for all these years, I think it's just hard to make that switch. But we have this discussion. I'm actually a part of another group when we meet on Wednesday mornings. And that's, we're always trying to tell people, because there are some primary care doctors that are in that group, and they're trying to make that switch, but they're really scared. But like we said, the good news of it is you already have a established practice. If you can educate your clients as to why you're doing it, more than likely you're gonna retain them. But again, I know it's not easy. I don't think it's easy for any of us when you've had kind of a job that you've been in, and you're making a, you know, reasonable living, to
Yeah.
try to make that leap, especially if you got family. I mean, that's just not an easy thing to kind of walk away from. Because you just don't, if you haven't been there, you're just not sure what to expect. I would encourage everyone to seriously look at it, because and you probably hear this too, there's more and more clinics, there's more and more solo practitioners that are going out and actually doing that. And I think there's a need for it. Uh, One of the comments we always say too is insurance really isn't there to make you healthy. If you want to be healthy, you have to be proactive and kind of pay for that. That's Insurance is really there for when you're really sick and you need other things. But the goal is for you to never get to that point. But the only way people are gonna do that is they've gotta buy into that system too, in addition to the practitioners.
Yeah, absolutely. So you mentioned that some providers may not make that jump or that leap because there's risk involved. And when there's risk involved, depending on everyone's unique circumstances, family, responsibility, so on and so forth, it's not a risk that they've calculated is worthwhile. Now, because of the chance of failing, right? Is there something that those providers can do? Are there like non-negotiables that would increase the likelihood of succeeding in that transition? And the one specific thing that I'm thinking is, if let's say you have an established practice and you want to transition into integrated medicine, functional medicine, practically you're basically saying, okay, not taking it insurance anymore, and these are the services that we provide and how we provide them. Is there a way to transition slowly into that where you're mitigating the risk, or does not making a full commitment and doing it pretty much overnight, cold turkey, where you're all in, is that the better chance for success in that transition?
You know what? I think if you're new and starting out, maybe just jumping in is great. I think if you're already established, I've seen a few clinics, and I still think this probably is the better option, is that you educate your current base or your current patients on this transition that you're going to make. But a lot of times, what I think works well is you say, okay, I'm talking to you about X, Y, and Z today, which I know the insurance will cover. I think there's some other therapies that you might benefit from. But if we're going to dive into that more, it would be an out of a pocket expense, but we can still do it here in the clinic. And you either have another provider that does part of that, or you have certain days and times where you're like, today is my Western medicine clinic day, and these are the hours that we have to actually give to people, so when they want to come in and talk or do some of these other therapies, we have set time for doing that. And I've seen clinics do that, and I think that may be a nice way for people to transition and not feel like they're jumping off a cliff and not knowing what they're getting into.
Yeah, yeah,
Yeah.
I think that's great advice. So you're sort of introducing new services in your with your current patient base and seeing what sort of demand there is for it.
Yeah.
Yeah, that makes a lot of sense. Um, let's kind of jump into BHRT. Let's talk a
Okay.
bit about that. Actually, I do have one question before we jump specifically into hormone replacement therapy. Did you attract a new patient base than the patient base that you were used to serving as a primary care physician? Or did you have, what was it, a similar patient base and now you're just educating them? You know what I mean?
Not for me specifically. I have to say, kind of when I jumped ship, I jumped ship. So that was, and again, the good, bad, or whatever. In this area, of Denver, that I'm in Southwest Denver. A lot of the people that are here, it's not that they don't want medications or prescriptions if they need it, but they're very health minded and they like the idea of natural. So if there's anything else out there that we could give them that might supplement or decrease their need for medications, that's great. But I have to say, for me, when I made the transition, it was pretty much it was a cut and dry sort of thing. But I do think if you have an established client base and you're going to make that transition, I still think you can attract new clients because there are those people out there that want the compounded, options, or they want supplements, or they want the education. I think you could add to the client base you already have. But in my situation, I didn't do that.
Right. So hormone replacement therapy. I have a lot of questions around this. I would love to get your perspective on a few things. There's questions that I've always had as a pharmacist, as a compounding pharmacist, when I would speak to different providers in the primary care world, general practitioners, and I would encounter providers all over the spectrum as it relates to their opinion on compounded medications, specifically hormone replacement, where I'd have a general practitioner that is 100% absolutely opposed to any sort of compounded medication. They're dangerous. We don't know what they do. We have commercial products, FDA approved, that we can use. We don't even, yes, we do hormone replacement, but we do not touch compounded medications. FDA approved only. Then you have the other end of the spectrum, a primary care physician that, it's not a massive volume in what they prescribe, but when they are balancing out an individual's hormones, they turn compounded medications because they may understand the side effect profile, the advantages to the customization, and the increased compliance, and so on and so forth, all the advantages. And I'm so surprised to see that within primary care, that's really the only place where you find people on opposite ends of the spectrum when it relates to that. Right? So it's an observation, and I cannot explain it. Do you have an explanation for that?
Just for the difference in opinions.
Like on compounded medications, like totally usually you see that with people in different industries, right? Like if you're in, I'll give you an example. If you're in commercial or big pharma, you have a very good reason to say stay away from non-FDA approved,
Right.
right? Yeah, that makes sense to me, right? They're not safe. They're not. But here you have a provider seeing the same patient, and one is saying compounded medication's evil. Stay away. We'll never use it. Extremely dangerous, right? And then a practitioner also, uh, general practitioner that completely embraces it and understands the advantages. Why do we see such difference of approaches to specifically hormone replacement therapy from a general practitioner?
I think there's a couple of reasons. Part of it is, again, when you're in training and med school and residency, it's kind of this black and white, this little box that we live in. And there's nothing wrong with that. You need to have that base, but they don't talk about compounded options, when you're in medical school or even in residency for the most part. And I have to say, even for myself, when I first got out, they kind of say this is kind of how it is, and this is the parameters you live in, and you kind of do that because you don't know any different. But you have to have that interest in educating yourself and knowing that things are advancing. And I'm not saying that medications and primary care as a whole is not advancing, but there's been so many things that have come out since I even got out of training. And I was very interested in understanding that how do we improve longevity? How do we improve mental clarity as you get older? What's truly part of the aging process, what's not? But if you're one of those people, you're like, okay, someone gave me these guidelines, I'm going to live within these, and that's all that I'm going to do. That's part of the reason. So one, you have to have the interest. I think the other thing of it is because years ago there really weren't other things for us to look into. Everyone came out with the same education and the same belief. I'm not saying all those beliefs are wrong. There just wasn't really anything else to hang a hat on. So I find that even I have clients come in and they're like, well, I have my practitioner that I've been with for 30 some years and, they're very black and white in terms of where they stand. I kind of understand that. Those things weren't around. They have no interest in learning it. I get it. I would have to say the younger practitioners coming out probably have a little bit more of an open mind, but you're still going to find some, depending on where they did their training at, that is going to be, this is kind of what we see. These are where the studies are at. This is what I'm going to follow. But again, if you're not willing to think outside the box and realize there's a lot of other options out there, you're going to kind of be stuck there.
And we're definitely seeing that, like you said, a lot of general practitioners moving towards that approach. It's integrated medicine and functional medicine, and of course, patient demand for it. Do you think it's driving a lot of the interest that providers also now have in it? Because
Oh, definitely, because I think there's so many more people that come in now. They're much more educated than they used to be. When I first started out, I still remember a guy that I talked to, and he'd gotten treated for a cancer, and he didn't know what cancer it was he had been treated for. He didn't know what sort of treatment he got. He couldn't remember how long he got treated for. This day and age, not that we expect people to know all the details, but people are much more educated and they know there's other options out there. They're going to come in and ask you for those versus, like you said before, people were just kind of like, you're the doctor, do whatever you want. They didn't really question anything.
yeah. So really, if you want to be more marketable, you would kind of have to start at least entertaining the idea of learning
Right.
that world and where things are going. Maybe it's a matter of time before. And again, nothing. We don't want to say that nothing is wrong with that mainstream primary care medicine. Nothing's wrong with that. But now it just the issue with it. It's a fraction of the whole story. So we have to sort of expand
It
it.
is.
Yeah.
Yeah. And like I said, good, bad, or whatever. I mean, before it used to be patients and clients didn't have a choice but to rely on the physician. Now there's so much information out there. Now, granted, I have to say it's not all true.
Yeah. Yeah.
And people can go down a rabbit hole and kind of decide it's conspiracy theory or there's some wild thing out there that, is either harming them or not harming them, whatever. It's just one of those things where there's a lot of information out there for patients and clients. I think that's great in one way, but you still need someone who's in the field that can really sit down and be like, okay, this is what you heard, but stats can lie, and this is the real information.
On that note, is there a very common misconception or
Hmm.
myth that you see that a lot of patients or providers buy into in this world. You have to educate patients or providers on to dispel. Is there just a common theme?
I'd say that the two big ones are, hormones causing cancer. Usually it's women worried about estrogen causing breast cancer. And then the second thing would be, again, if you're talking about whether it's pellets, compounded, bioidentical hormone replacement therapy, the concern is, well, how well regulated are the pharmacies? Well, just like the big pharmaceutical companies have regulations, you still have regulations as a compounded pharmacy. So that's things we always have to kind of talk through with people.
Very, very interesting. Again, in my world, it's very rare to find a provider that is able to speak on how a compounding pharmacy is regulated, right? Usually that's when we would step in and go through all of the different regulatory bodies that have oversight in the industry. I mean, it gets intense, right? Like as you can imagine, it gets very intense. How did you, I guess, how did you come to understand what sort of equivalent there is in terms of regulations for compounding pharmacies? How often do you have to educate patients on that?
Well, a lot of it is just through my working with compounded pharmacies, but I also have done a few programs. You may know some of them as A4M, which is the Academy of Anti-Aging Medicine. So there's just a lot of information. When I first started out, that's where I got, the majority of my information. And then you start meeting other providers, you start talking to other pharmaceutical companies, more the compounded pharmacies, and just talking with them and understanding that there's still regulations they have to provide. It's been a work in progress. Yeah. But I'd have to say the patients and clients probably they don't question maybe the compounding pharmacies as much. They will occasionally bring that up, but really what it comes down to is they'll come in and say, well, it's my primary care physician or my gynecologist told me it's not safe.
Yeah.
That we really need to stick with these other options, and I don't understand why, and I'm not getting the results that I want with those options. So that's usually what it comes down to. And then once we kind of go through that, I usually explain to them that there's still regulations. It's just because they're not a big pharmaceutical company doesn't mean that they don't have regulations to.
So does the specialist, if they advise the patient that the medication may be unsafe,
Uh-huh.
are they referring to a medication that's compounded, or are they referring to generally hormone replacement because of its association with cancer, allegedly? Is it for that reason or because it's a compound?
I wouldn't say so much that it's cancer provoking. Now, that's usually what a lot of the patients worry about. I think a lot of times they feel like there's not enough studies and insurance doesn't cover it, so that means it's not well documented enough.
Yeah.
And I think, and again, that's where we kind of get that discrepancy between some of the primary care providers, because some of them are just, they're in that mind and they're like, they never taught me about it. There's a reason they never taught me about it. I'm not going to look into it. And it must be because it's not safe.
Yeah, and I do understand that. I do understand that because when you only have so much time to build a belief in something through anecdotal evidence, because at the end of the day, compounded medications are not FDA approved, right? So we don't have the same lengthy, involved studies that are published in medical journals, so on and so forth, right? So as a healthcare practitioner, I understand advising a patient strictly based off of the hard evidence, like that we published in journals through studies. I completely understand that too. And so I guess they tread with caution when it comes to compounded medications. And yeah, that's where the interplay between the patient and what the patient demands. I guess they'll go find that provider, a place like Essex Medspa, right? That will, I guess, uh, responds to their desire for a more integrated approach. Now, if you have a provider that's interested in learning more, right? Can
Mhm.
you tell us a little bit about how you did that? How did you educate yourself? What conferences, trade shows, the internet, real world experience? How did you educate yourself on how to treat a patient that is looking for hormone replacement therapy?
Yeah, I think a lot of it, like I said, I kind of started out with A4M, but then you start as you're doing this, you start meeting. And what I tried to do is reach out to other providers in the area
Mhm.
that were doing similar things. And then you kind of have your, if you want to say your colleagues that you can bounce ideas off of. And then the one group that I mentioned to you that I work with on Wednesday mornings, we always have conferences. That's part of what we do. We're bouncing ideas off of everyone and just saying, hey, this is what I've heard. What's your experience? What are the pros and cons? And as you were talking about, as far as studies, there are some studies that are out there on things that aren't necessarily FDA approved. So there are definitely some studies out there. And there's some studies out there that on medications that are FDA approved. But when you really dive down into the literature, one of the things, this is a different topic, but even like with cholesterol, people have this big thing about statins helping reduce the incidence of MIs. They do reduce cholesterol. The impact they truly have on the occurrence of MIs isn't quite so strong. And that's where you really got to know the evidence. Same thing true for estrogen with the women's study they had or initiative they had. There was a big concern about estrogen causing breast cancer. For all of those situations, whether you're talking heart disease or you're talking cancer, whether it's breast cancer, other things, it's a lot of times it's not a black and white picture. It's not that estrogen is bad. It's not that progesterone's bad. It's not that statins are necessarily bad, but they may not necessarily be as helpful as you think. There's a lot of things that factor into that. A lot of, we call it epigenetics. It's how inflamed is your body? What are you doing? How do you sleep? What's your stress level? What are you drinking? What are you eating? There's all those things that you got to look at the bigger picture. It's not just one thing. So, and I think that's again, really where you need to be able to educate your clients and your patients and give them that full picture and sit down with them and have that discussion about here's the pros and the cons. Don't tell them what they have to do. You help guide them, give them some information and let them think about it. It should really be a joint decision. I think years ago, and maybe it's still true in some of the practices, it was more like the doctor said, this is what I'm doing. They didn't really give you any education. They just said, that's what you're doing. Yeah.
Yeah, I've had a lot of experiences where I felt silly for asking questions. I would
Uh-huh.
ask questions, and you were sort of made to feel a little silly for asking. How, it's like, just do what I tell you to do. That's been. I would say I've had that experience more often when I've seen a specialist in the past.
Okay.
Yeah. Now, that's not to say I definitely don't want to extend that generalization across the board. I've had amazing experiences also with specialists and primary care physicians when asking questions. You mentioned that one of the major myths that you feel like you have to address is the dangers around hormone replacement or the perceived dangers around hormone
Right.
replacement therapy or whether it's commercial or bioidentical, and its, I guess, perceived association with cancer. Um, and that seems to be pretty prevalent. We encounter,
Definitely. It's probably the biggest concern, yeah.
yeah, yeah. When we do consultations, that comes up all the time. Now, I guess where did that originate from? And you did mention a couple studies that the conclusion was that there may be an association, but is it just those studies, or are some providers educating their patients that it does cause cancer, right? And so where is this misconception originating from?
Well, I think it came again, I think a lot of it came from that women's health initiative for both on the provider side and for the patient side. Because obviously, probably when those studies came out, the patients didn't know anything about it, but it was all the providers giving them that information. But again, the myth about that was that estrogen itself was cancer provoking for breast cancer. But what they really, when they went back and looked at it, it wasn't that. It was the medroxyprogesterone, which is a synthetic version, that it was the combination of those two. There's something about the way the body metabolizes and interacts with that estrogen when you're on both that really causes that increased risk for breast cancer. So, yes, did the estrogen probably play a part in causing the breast cancer? Probably, but it wasn't just the estrogen. It was, again, it's that combination of things that are going on that's really the problem. So you really got to know the details.
Can you tell us what an interaction or an experience kind of walk us through an experience that a patient may have from their first consultation and what their journey looks like as a patient in your practice.
Out of the gate with the consultation, we look at everything. So you, just like you would if you went into a regular primary care doctor's office, I want to know everything about your family history, procedures you've had done, treatments you've had in the past. Um, and then know what's been successful and what hasn't. And again, obviously, my biggest question is what brought you here? So we know really what to focus on. But we're going to look at all that. And then we're going to sit down and go through whatever the concerns are. I'll look at different options. But again, I'm going to take that time because I have the time. I'm going to take the time to educate you on the benefits and again, kind of the pros and cons of all those options. And then we'll sit down and see what makes sense. Because what makes sense, even though there may be three options that are good for two people with similar issues, depending on their lifestyle, depending on their concerns, there may be one that's better than the other. So that's kind of, we sit down in conjunction with each other and talk about it. It's not like I'm going to say this is what you have to do. So, but I've had clients, like I said, whether it's been weight loss or hormone therapy. I had a woman years ago who came to me and said, I just simply cannot function. I'm at work. I can't concentrate. I'm moody at home. I'm mad at my husband all the time. And it's that kind of stuff when you treat those people and they come back, they're like, oh my gosh, you just changed my life. That's when it's worth it. Or I've had clients who have been on statins and they're like, I think the statin truly is making me miserable, but they're too worried about taking me off of it. And I'm able, with a little bit of changes, sometimes they're on blood pressure medication too. We can decrease the amount of medications they're on. And a lot of times we get them off of them. But I always tell people, I'm not against statins. I'm not against blood pressure medication. If you're in one of those situations where you really need to have it, then you need to have it. But I really want to look at the bigger picture. And a lot of it is it's educational lifestyle because it's the poor American diet. It's the bad habits. It's that's causing a lot of the inflammation in the system. It's that inflammation that again makes you at higher risk for having any type of cancer, including breast cancer, and makes you at higher risk for heart disease.
Yeah.
So we got to look at the big picture. We can't just, live in this little box.
Yeah. What I'm gathering as I hear you speak more about your practice, I think in a market that's becoming very saturated, when you see like med spa or medical spa or anything like that, I think there's still like really on the surface, it may seem like there aren't a lot of differentiators between practices, but the more and more I speak to people, I feel like there are very significant differences between medical spas based on the owner and their experience. When I speak with you, I feel like you're striking such a good balance between, with no negative connotation whatsoever, when I say mainstream medicine, right? I just mean like what we're used to, evidence-based, let's say that, right? I think you strike a balance, which is very hard to do, I think, between, let's say, that world and then the integrative medicine and holistic approach, right? I use that
Right.
term very carefully, right? I think you're like kind of like right in the middle where you're bringing in truly the best of both worlds. And as a patient, I would find kind of reassurance in that, right? Because there's still that trust factor that we all have in your mainstream medicine, in your general practitioner, and your FDA approved drugs. There's a sense of security and trust there and in that system. I believe so. And then there's also some trepidation or fear in introducing new things and like the new world, but it's also very, very necessary.
Right.
It's a, parts of it, components of it are extremely necessary. And it sounds like at a practice like yours, you're really marrying the best of both worlds, which is really cool to see. And I can't pinpoint exactly why or how you're able to do it, but that's just what I'm sensing, because you're not, you don't have any extreme position on any one thing. You're like, okay, stands. Okay, let's talk about it. But here's where I think it's appropriate. So truly tailors to the situation or to the patient. But I did want to talk to you a little bit about cholesterol management. Can you tell us a little bit about your approach to cholesterol management?
Again, I have people that come in that have just either started having high cholesterol or they're trying to get off of their medications. And we'll look at things. I mean, there's definitely a lot of supplements that you can do out there. But again, we really got to look at if you want to say the foundation of all of it is lifestyle. So what are you doing? I mean, are you having hamburgers and french fries from McDonald's a couple of times a week? Are you cooking at home? Are you eating vegetables? Are you getting a variety of foods? Or are you eating all the same stuff? Are you so stressed out that you're not sleeping? Because then that increases your cortisol level and that increases more inflammation. So we look at all those kind of things and just see what we can do to modify. I actually had a CEO that she still comes to see us now. She worked for Google and she just said, she goes, for years, I've been able to get by on so little sleep and I just drove myself into the ground. And I said, good for you that you were able to do that for so long, but something's got to change. I mean, you just can't run like that anymore. So again, we sat down, we looked at, cholesterol things for her. We got her feeling better. We got her sleeping better. We had her change some of her lifestyle habits and it's made a big difference. So I really like to look at that. And if I need to, I'll recommend other things like berberine. If I feel like they need to stay on a statin for a little while, we may just ask them if they've been put on a CoQ10 supplement. I do have to say the cardiologists and some of the primary care doctors are getting better about recommending that. But for years, I'd have people come in and they're like, I have no idea what you're talking about.
Yeah.
So, we'll look at that. But then there's, like I said, there's a lot of other things you can put people on, garlic supplements, ginger, there's quercetin, there's resveratrol, there's all these other things that we have. Again, tools that I had to learn were available to me that I didn't necessarily ever use when I was doing primary care. So we will look at that big picture. And I tell people, though, I'm realistic. I always tell them, if you've got a risk factor, whether it's family history, you're diabetic, you're smoking, and there's other things, you've had MIs in the past, maybe we can't get you off all of your medications, but maybe we can at least decrease what you have and or we can at least decrease the side effects you're having from those medications.
Like you said
Yeah.
earlier on, reduce the side effects and optimize results.
Right. Because I think one thing that patients, and I even have to say, being in primary care, we talked about side effects. But the things we used to talk about was more the short-term side effects. You have those few people that maybe you give them this medication and they get itchy or they get fatigued with it with like beta blockers. But what we really didn't talk about at all was the long-term side effects that
Uh,
people can have going down the road. And
yeah.
that's one thing that at least when I was going through training, we just didn't discuss those sort of things. And we know now, yeah, sometimes you have to be on these medications, but maybe you don't have to be on them forever. And our goal would be if you can, let's try to get you off them. But if you have to be on them long term, let's look at the things that we can supplement you with to decrease those long term side effects.
Yeah. I mean, I like that approach, and it's in such clear contrast. Like, I'm thinking back into pharmacy school now, right? And we, of course, discuss the side effects, acute or chronic, in detail. But the next question is now, how do we treat the side effects, right? What medications are we going to use to treat the side effects?
Well, and yeah, because that sometimes is a compounding issue because then you've got more medications on board. This medication to treat that, to treat that, to treat that. Yes. Yes.
And what's so different here is we're not, the first question we're asking is not how are we going to treat the side effects. The first question we're asking is how are we going to reduce the side effects? Let's first talk about that. Let's talk about getting you off the medication or titrating down or right, which when you insert that question first, you can have such a different outcome for the patient in the long term. And it's such a like it seems like such a small tweak, right? Just yeah. I mean, you hear this all the time, right? If you ask the right questions, it can also lead to the right outcome, right? So a lot of times we're asking the wrong questions. So I would love to hear to kind of to close this out here. You mentioned earlier a couple success stories. Makes it all worthwhile when you hear these stories and you've had an immediate impact on somebody's life, right? I imagine that's very meaningful to you. Do you have a win, let's say, or a case study, one that stands out in your head that you can share with us? Can you tell us a transformation story?
Yeah, I'd have to say there's one client in particular. I've seen her for years, and actually the reason she came to see me was more on the just wanting some things to kind of refresh her look. But she ended up gaining weight over time and was having issues, but to the point, and not that who likes to gain weight? None of us do, but it was really impacting her ability to function on a day-to-day basis. And the more she kind of got down on her weight, the more she got depressed and it was just this vicious cycle. She came in, I can't remember, there's probably a gap when all of this was happening because she really wasn't even coming in to see me because I think she was just like, whatever, I give up. I look like crap. I feel like crap. she didn't want to do anything. So she finally came in, and I think she came back to see me actually for some skincare stuff. And we started talking about everything else. And we started getting her on some things to help her with her weight. In the interim of that gap, when I hadn't seen her, she had actually seen her primary care physician. They had put her on blood pressure medication. And I'm trying to remember now if they had her on cholesterol medication or not, too. But we got her on something, got her feeling better with her weight loss. She was able to maintain it. She came off of her medications. She had gotten to the point, and that's when I say she was depressed, it was so bad. She was ordering in food every day. She didn't want to cook. She was getting Uber deliveries, doing all this kind of stuff, not going outside, not doing anything. We have gotten her to the point she's off the medications. She's maintaining her weight. She is exercising. I don't get me wrong. I had to pull a few teeth, but I got her doing it. I gave her some nice little tips on little things she could do at home. She didn't necessarily have to go to the gym, but it has transformed her world. She is not depressed. She is not on a medication, and she actually got herself a new job. So it's been, yeah.
It sounds like if there was a one-stop shop, like therapy, clinical psychologist, like everything, right? You kind of like hit every single component.
Well, and like you said, that's what sometimes happens. So it's one leads to the next, leads to the next. So it's just one of those things where it's so good to see that, where you just kind of make those incremental little steps and you kind of start reversing things and going back to where they were before.
Yeah. It
Yeah.
sounds like you're really good at relationships in terms of building trust and, to get somebody to do something or to facilitate that, like they really have to trust you. You know what I mean?
Yeah.
And they have to feel cared for, or they have to feel loved at the end of the day, right? That's when they start listening. Their defenses are down. To be able to impact somebody's life to that degree, number one, I feel like you'd have to be very passionate about it, and you'd have to have a wide skill set range when it comes to people, a very wide skill set
Yeah.
range. And then outside of your technical expertise, of course, as a physician, and that too. So really cool, really cool. We could use more practitioners out this way that approach everything the way you do. It was a pleasure speaking with you today, Jill, and picking your brain and all the golden, uh, nuggets that you provided today. And I'm hoping that our paths cross in the future and that we get to speak again. I think we can dive a little deeper into a number of topics. And this is a very fun conversation to have. So it was nice having you on.
Well, I appreciate the opportunity, and I would certainly love at some point for us to sit down and talk a little bit more and get more into the thick of things.